patient of ours, and we have known her since weeks now. That's because she came all the way from the north of the country, firstly to get a facial surgery. Now for her, the facial surgery which she was desirous of was a chin augmentation. By chin augmentation we mean a genioplasty wherein bony cuts were involved. I'll go on to show you as to how her pre-operative look was. So this is how her pre-operative picture is. In the front profile, we can easily appreciate the vertical length was less, the vertical length of the chin. So the lower 1/3 hence was overall short if you're dividing the face into 3 halves. We'll also show her side view. So this is her side view, and we can clearly see as to how receded the chin was. It was set behind, because of which there's lacking in horizontal as well as vertical dimension. So if you can turn your head towards this side, and we can see as to how the difference has been. It has been augmented both vertically and horizontally by Dr. Richardson. Also, since she's a young girl, and for giving that feminine pointy look, we have achieved a V line for her. So we can see in the front view as well. The most marked difference also being, we can see, I'm even telling you, you can see this lax tissue, the fold which is there. That was because the chin was very short and receded inside. So now this is the difference that we see. Both vertical and horizontal augmentation done for this girl. It's been a bony movement, a genioplasty way for chin augmentation. We'll show the other views. Yes, even if you look straight, we can see as to from this blunt, it's a V now, and it's gone down because the vertical increment and also the horizontal component. If you turn that side, we'll also go on to show her scans, but that's it as of now. Thank you.